Hi, my name is Kayla Nadeau, and in this presentation, I will be going over autism versus schizophrenia. And the research question that I'll be hitting on in this presentation is, what are the traits and behaviors that help you distinguish autism from schizophrenia? First, before I dive into those specific traits and behaviors, what is autism? Autism spectrum disorder, which we refer to as autism, is a neurodevelopmental disorder that involves a wide range of problematic behaviors, including deficits in language and perceptual and motor development, defective reality testing, and impairments in social communication. So, to break down that a little bit further, autism has many subtypes, and each person with autism can have unique strengths or challenges that come along with their disorder. For example, I worked with a young boy who had a fixation to calendars. He could tell you what day December 5th fell on, or you could ask him, January 10th, and he could say, oh, that was a Tuesday. It was just completely incredible of what his mind could do and how he could remember all those little details about the calendar. But to continue, many people with autism also have sensory issues. These issues can include aversions to certain sights, sounds, and other sensations. For example, people with autism don't really like loud noises like fireworks or firecrackers or things like that. It kind of throws them off their imbalance. Or say that I had a presentation up on the board and it had a lot of flashy lights. They are very drawn into those kind of things. Autism is known to affect an estimated 1 in 59 children. Autism symptoms usually appear by ages 2 to 3, and this disorder can be diagnosed as early as 18 months. Now, what is schizophrenia? The disorder is characterized by an array of diverse symptoms, including extreme oddities in perception, thinking, action, sense of self, and manner of relating to others. However, the hallmark of schizophrenia is a significant loss of contact with reality, which is referred to as psychosis. So, some of the behaviors and early warning signs that come along with schizophrenia include hearing or seeing something that isn't necessarily there, a constant feeling of being watched, odd speech or writing, strange body positioning, and feeling indifferent in very important situations in the person's life. When it comes to medical and mental health professionals, they may use the following terms when discussing the symptoms of schizophrenia. Positive symptoms. These include delusions, hallucination, disordered thinking and speech, and disorganized behavior. While negative symptoms include social withdrawal, extreme apathy, lack of drive, and just overall emotional flatness. Therefore, what are the traits and behaviors that help you distinguish these two disorders? So before I dive into that, I want you guys to know that these disorders have distinct characteristics, but they share some similarities in social dysfunction. So during this PowerPoint, I will be going over the similarities first, and then I'll describe the two differences between the two disorders. So some of the dissimilarities are both are considered neurodevelopmental disorders because they both have atypical neurodevelopment. They also share negative symptoms. These negative symptoms can include social avoidance, emotional flatness, and the most common that is shared between the two is poor attention. They can also have odd thinking and speech. Both disorders engage in repeated and stereotype movements and verbal expressions. They both have significant difficulties in interpreting social cues. So they really don't know how to dissect someone's facial expressions, and they don't really understand what those facial expressions the person is expressing means. Also, the risk of these disorders increase by advanced parental age. Now, to just discuss the differences in autism. Autism symptoms must be present in the early developmental period, but may not become fully manifest until social demands exceed limited capacities or may be masked by learned strategies later in life. And you can also start seeing symptoms less than 36 months of age in the child. Like mentioned before, they have extreme sensitivity, so sensory sensitivity. There is no cure for autism spectrum disorder, and there's currently no medication to help treat it, but there are some medications that can help with the symptoms that come along with this disorder. And to put schizophrenia in this perspective, even though there is no cure for schizophrenia, you can treat and manage it with medication, unlike autism. So now to discuss schizophrenia. 2 or more of the 5 symptoms must be present for a significant portion of time during a 1-month period or less if successfully treated. So this is a part of the DSM-5 criteria. Also, at least one of these symptoms must be present. And these symptoms include delusions, hallucinations, and disorganized speech. The onset of this disorder is also very different than autism. Schizophrenia, females start, having symptoms, and you might see a few things arise in 25 years of age in females. But in males, it's 10 years younger at 15 years old. While, like mentioned before, autism is usually diagnosed between 2 and 3 years of age of the child, while, as you can see, schizophrenia is a little bit later in life, teenage to young adult lifehood. So these are the journal articles that I got my facts and information from. This first article provided me with a brief review of the main interactions between autism and schizophrenia. The study showed, connections and broke up the connections very clearly, and I'll be dissecting a little bit more of that to give you guys a better understanding of the similarities between these disorders. Therefore, environmental risk factors include advanced parental age, prenatal viral infections, and immune activation during pregnancy. Genetic factors include autism and schizophrenia both have rates of heritability that are estimated to be around 50 to 80%, while neurobiological features include cognitive impairment and negative symptoms. Brain imaging, patients with autism and schizophrenia show abnormal development in certain brain regions. And the clinical features. The relationship between these two disorders may be so close that a subset of cases of autism and schizophrenia are undiagnosable, especially in childhood cases of schizophrenia in which delusions, hallucinations, or disorganized speech have not appeared yet. So lastly, with this article, they gave a little section of social cognition. This is known to be deficits in the speed of processing and emotional recognition. Studies have also showed deficits in the theory of mind. The next journal article that I got my evidence from was an article based in 2017. The journal article explained that there is clinical, neurobiological, and genetic evidence for the close relationships between autism and schizophrenia, and it also shows the symptoms overlap. This article discusses how the DSM-5 maintains the distinction between autism with core social and communication impairments and schizophrenia with hallucinations and delusions. Autism and schizophrenia have common biological support that may emerge early in development and unfold over time. So, meaning this study really focused on the EI imbalance and neurodevelopment in these two disorders. Finally, the third article that I used as a reference was from the University of Texas at Dallas, and it was based in 2012. This article talked about how both groups are known to be poor at recognizing social cues, like mentioned before, and that they often have trouble identifying emotions in other people. So sometimes their reactions to people may not be that appropriate. By not picking up on subtle cues and interactions, adults with autism or schizophrenia may alienate other people and have trouble making friends or getting along with classmates or coworkers or maybe even any other person in their daily life. The researcher in this journal article stated, people with schizophrenia have a much higher likelihood than the general population to attribute ill will to others and is likely tied to their delusions. On the other hand, people with autism are more socially doubtful. They seem to be exhibiting fairly realistic responses to people as a result of the challenges they faced in life because of their condition. So, I really wanted to go over this slide a little bit to kind of give you an overview of what the presentation was about. So, why is there so much confusion between these two disorders when it comes to diagnosing a client? The reason is for many years, the similarities between these two disorders resulted in confusion in diagnosis. And this is because many young people with autism were thought to have a childhood version of schizophrenia. Also, because of these disorder similarities, it was known to be hard to distinguish between the two at such a young age. So in conclusion, a conclusion to this presentation and maybe the future direction for future researchers, future research should therefore consider focusing on similarities shared between autism and schizophrenia. Thus, by identifying the overlapping areas, could be a good starting point for future research, and it could be aimed at developing and evaluating the effectiveness of new procedures and therapeutic tools for clients suffering from both of these disorders. These are my references. I hope you enjoyed my presentation. Thank you so much for watching.